Keir Starmer has brought the NHS into one of his mission statements. I'm just going to show you a slide. Mission 2, build an NHS fit for the future by reforming health and care services to speed up treatment, harness life sciences and technology, reduce preventable illnesses, and cut health inequalities. It's a bit vague. I'm just going to show you the speech that he made to complement this.
Build an NHS fit for the future by reforming health and care services to speed up treatment, harness life sciences and technology, reduce preventable illnesses, and cut health inequalities. Equally, I have to say, I'm not concerned about whether investment or expertise comes from the public or private sector. I just want to get the job done. And I mean that. We have to get it done. There is a massive role for the private sector in mission-driven government. But if the aspiration is merely to replace the public sector while extracting a rent, to privatise the profits while socialising the risk, that takes us nowhere. Mission-driven government is a different way altogether. Not state control or pure free markets, but a genuine partnership, sleeves rolled up, working for the national interest.
Well, I mean, he said sleeves rolled up, which was, I'm surprised he didn't have them rolled up as he always does when he goes to a hospital. So, Dr. Bob, what do you make of this idea that you can mix public and private? And as he said, the idea is that private companies don't extract anything out of the deal. Do you know of any occasions when public-private has worked like that?
Hi, Crispin. Yes, Starmer is continuing his brainwashing and hoodwinking of the public. He knows that he needs to keep those who believe in the NHS docile. So he has to throw out the phrases about the private sector not being allowed to extract profits and rents, which is total nonsense. That's all they're in it for. If they could extract money without even touching a patient, they would. In fact, that's what the private health insurers do. They don't provide anything. They're just a bloated layer of intermediaries. And that's what Starmer is in favor of, because he doesn't spell out what the problem is. He doesn't spell out what ails the NHS, because he wants to carry on more of the same. It's a bit like if Starmer was a doctor, he fails to examine the patient, fails to come up with an accurate diagnosis, but has a prescription for a medicine which is going to kill the patient. That is Starmer in a nutshell. This fantasy that private companies are doing it for the good and they want to help us lower the waiting list is a nonsense. Where is this idle workforce in the private sector that's going to help us? Why is it necessary that we have to use private sector capacity? Is because Starmer, New Labour and the Tories have all engineered a collapse of NHS services so they can present the private sector as coming to our rescue. So this is a problem, reaction, solution cycle that our politicians and our political class and media have reinforced and created. And the solution Starmer is prescribing for us is same old New Labour pro-privatization nonsense. And how they're going to get away with it is dressing it up as partnership. Well, public-private partnership is a mechanism to conceal corruption, because that's what's happening. Money we pay in taxes is being siphoned off for other uses, for corporate profit, for shareholders. That is a corrupt scheme, and that needs to be exposed. So, Starmer and Wes Streeting have indicated time and time again that they have no genuine desire to restore the NHS. The prescription he should be writing for the NHS is a renationalisation bill. That's what we need, and that is definitely not what a Starmer-led Labour Party is going to deliver.
And yeah, you've made a great point, because the NHS is in such a bad state because of these public-private partnerships, and he's asking for more. It's kind of bizarre that he thinks the answer is more of the same. But if you put NHS in a manifesto, if he doesn't put NHS in a manifesto, everyone will say he's sold out. So he has to put NHS as a mission. And then the way he's worded it is that he's going to help patients more. I mean, how he said it will be faster treatment. How can that happen with the public-private? Is that just a lie? Is that just a blatant lie, or is there any possibility that patients can be treated faster with that partnership?
Well, you can engineer it to work, can't you? So if you create so much dysfunction within the NHS, let's say if you're on a waiting list for complex heart surgery, and there's never any ITU, intensive care space, in your hospital, because the hospital is struggling to cope with all the demand, well, at some point you might say, well, maybe I'll do that operation in the private sector, where I can guarantee that they will have somewhere appropriate to recover. But that's not because the NHS couldn't do that operation. That's not because you don't have the manpower to do it. They don't have the resources to do it. They might not have theatre space. They might not have enough anaesthetists. What Starmer is not commenting on, I'll give you one mechanism for engineering this transfer of activity out of the NHS, is what they've done to consultants' NHS pensions. Now, it's so perverse that they will pay so much tax on their pension contribution that in effect they are paying to go to work. So that is going to push more of the most senior consultants into the arms of the private sector. And that is just one tactic they've used to engineer this drift out of the NHS, reduce capacity, alienate the workforce, and financially stack it in such a way that you'll be crazy not to move as the policies and the politics plays out.
And if you do say that you're backing public-private partnerships, it's quite okay for you as a politician to take money from private health companies, isn't it, as well? I mean, we've just seen that Labour's shadow health secretary, Dr Rosanna in Tooting, has been paid money by private healthcare. So it's fair game if it's a partnership and they're doing it for benevolent reasons. I mean, if he can make private companies look like they're helping us, then why would we complain about that?
Well, exactly. It's a con trick. It's a spin. I can name several public-private partnerships that have been disastrous. The private finance initiative scandal, the building project for hospitals. You had that firm that went bankrupt, leaving the Royal Liverpool Hospital unbuilt and saddled the taxpayer with an £8 billion black hole. And the most recent disastrous public-private partnership is what they did with the management of the pandemic. We squandered 37 billion on a Deloitte Serco-led pandemic response, which failed to affect the spread of the virus and has left us with no extra capacity within in terms of hospital beds or workforce. So you have had this vast amount of money siphoned out of healthcare, but it's put on the NHS budget as a spend. But where did that money go? It disappeared in these trumpeted public-private partnerships. They are a con. They are a way of transferring public wealth to private hands. That's all they are. And maybe one of our esteemed journalists who are invited to his conferences and his public appearances, maybe one of them could one day dream up asking him a hard question, get him to name a successful public-private partnership which didn't enrich the shareholders and didn't enrich the CEOs. Name one. They are not benevolent. They are not a charity. They're in it for the money, and they will only do things that they know are guaranteed to be lucrative. Public-private partnership is a con trick.
Now, the final question is, he sort of makes out this is a 10-year plan, a bit like Stalin. I mean, not that I'm saying there's any Stalinism involved in Keir Starmer, but in 10 years' time, Wes Streeting and Keir Starmer run NHS. Where would it be? What do you think it will look like?
Well, of course, neither of them is making any of the key decisions. These are just mouthpieces. The people making the decisions, the people writing the legislation, are people like McKinsey, the management consultant, the people who are doing the propaganda and coming out with the public lines for these political puppets are the big four accountancy firms. One of them, Deloitte, I've already mentioned, Ernst & Young, PricewaterhouseCoopers. These are the people who shape policy and shape legislation and tell the politicians what to say. They haven't got a unique thought in their heads. All they're interested in is grabbing power for themselves and exploiting their connections, and maybe after they're out of power, do what Tony Blair did and accumulate £100 million worth of wealth. That's the game they're playing. So I want to say to those good people within the Labour Party who are advocating staying and fighting, well, I can't see much fighting going on. Where is the fighting? Who's challenging these policies? There's no public challenge to Starmer's ludicrous positions, which totally betray all his pledges. Where is the Socialist Campaign Group? Where are our key political figures calling out his nonsense, particularly on the NHS, which I'm very passionate about, and I can see through all this spin. You know, the stay and fight brigade are very silent, if not completely neutered.